Hi everybody, I'm Ed Baker. I am your host for the Addiction Recovery Channel. ARC is a TV show that's dedicated to bringing you current and accurate information related to this brain disease that we call addiction or substance use disorder. Today I'm very pleased to have two distinguished guests. We have Maureen Leahy and Cam Lauf. Thank you so much for being on the show.
Thank you.
Maureen is the Administrative Director of Neurology and Psychiatry at the UVM Medical Center. Maureen directs the Day 1 and addiction treatment programs within the Department of Psychiatry at UVM. She's also the liaison between UVM and the community, specifically regarding issues related to this opioid tragedy that we face every day in Vermont. And Cam Lauf, who is a certified recovery coach through the Vermont Alliance for Mental Health and Addiction, who is based at the Turning Point Center of Chittenden County. Thank you. Thank you for being on the show.
Thanks for having me.
Thank you.
Maureen and Cam have created a partnership between UVM and the Turning Point Center of Chittenden County that houses a very innovative program at the emergency room at the University of Vermont Medical Center. And we're here today to discuss this. This is a truly innovative program. It's based entirely in the science of brain addiction and recovery. And that's where I would like to begin. I would like to begin with your energy, your dedication. What is it about this concept, about this program, that causes you to be excited and have advocated for its creation?
You know, it's, I think the fact that it's innovative is part of what caught my attention. You know, clearly what we've been doing in the past hasn't been working well enough. And so the idea that we're trying something new is important to me. And then, you know, meeting and working with Cam has been what has helped me see what role a peer coach can play in somebody's moment of opportunity to get into recovery and into treatment, or into treatment and into recovery.
Moment of opportunity to get into recovery or treatment or both.
Right.
This is like music to my ears, that moment. You hear people more and more today talking about moments where motivation lives, moments where we have to intervene.
Right.
Cam?
Yeah, I fully agree. That moment, that window that we're looking at, it's often 5, 10, 15 minutes where an individual afflicted with addiction would think about change, and their willingness to change can grow over that time, but then it can subside almost immediately. So if we're able to get in there and provide motivation and provide support, we can help them continue that path towards engaging in treatment and recovery.
Yes, I think it's the American Society of Addiction Medicine, in its definition of addiction, cites that it's a brain disease where neurotransmissions that affect memory, motivation, and learning are compromised. Let's stick with that just for a minute. This idea of motivation being a brain function that's compromised by addiction, and how your program capitalizes on understanding that importance of that moment where motivation lives. How do you go about engaging that person at a very dark moment, a moment that has historically been characterized by shame and shunning? What is it about your program that makes that moment different?
Well, the motivation may not be for what we would want it to be for. Motivation may be to continue to get high or to continue to drink, but that motivation is categorized in a coping mechanism to keep a person safe. So the individual is resilient at the core. What we hope to do is actually sort of illustrate or highlight how this motivation can change. Using connecting with us, illustrating certain, opportunities that are available for people where they wouldn't think that they had in the past, just based off the barriers that are present in their life. So the motivation is there, the strength is there. We just have to cultivate it, or even, turn it in a different direction.
Maureen, you want to comment on that?
Yeah, I think the other layer that is at play is the role that CAM's team plays in converting the emergency department from a place where people may have felt stigmatized or shameful into a place where there are people there who speak their language, who have been through some version of what they're going through, and who can actually help act almost as translators between a medical team who historically has been focused on the medical issue at hand and what the patient needs from a substance use recovery treatment perspective. So it is hopefully making our emergency room a more welcoming place for people who live with substance use disorder.
That's really interesting that you mentioned that idea of translator, because as you were both speaking, I was thinking of the emergency room almost as a foreign country. That a person who wakes up in an emergency room is in a setting that is completely foreign to them. And having someone who has had that experience or really understands that experience from the point of a patient, not a physician, can really translate the experience into something that feels safe rather than threatening. I mean, I can imagine that if you're in an emergency room in an emergency situation that has to do with substance use, that your main motivation is to get out of there and forget it.
Right.
And maybe not have anybody else remember it either because of shame and stigma. But from what I read from the protocol is really designed to make people feel safe, engage them wherever they are, and hopefully set up another appointment, and then another appointment, and then another appointment to work with them and increase that motivation. You want to speak about that a little bit, that protocol to engage?
Of course. So throughout my entire schooling, it's understood that you meet the patient or you meet the client wherever they're at. Regarding the stages of change, a person can be in pre-contemplation or even contemplation, but not at that point of action. And the protocol is designed to really help a person kind of attach to whatever resources they have around with them, and to keep them engaged so that they have all of these opportunities to possibly make that switch towards action. The protocol is designed to provide compassion and support and also familiarity amongst that interpersonal connection. Individuals enter the emergency department, they feel alone, they feel scared, frightened, and it's like being caught in a riptide without the energy or the stability or resources to get out.
Caught in a riptide. I mean, not being able to move forward and not being able to move in any direction.
Yeah.
People the general public, I think, misunderstands that. The general public, people who are not familiar with the signs of addiction, just think that people with addiction are not motivated because they don't want to be. It looks kind of like a choice. But this lack of motivation to move into health is more a symptom of the disease. We know this. We can see actually brain imaging that can show that today. So when you talk about pre-contemplation and contemplation, you're talking about the person's ability to really begin to reflect on themselves. And how would a coach engage somebody who is in pre-contemplation? What would be the connector that you would use for someone that is in the emergency room and hasn't really even thought that they may have an issue with substances?
It would really depend on what the individual is presenting. Certain barriers, certain consequences as a result of their actions, whether that's health related, criminal in nature, if they're losing relationships, especially if they're alone. What we can do is sort of bring to light these consequences which may be pushed away as a result of the shame and the frustration of being there. We can bring up these consequences, but in a caring way, without sort of isolating the person, saying you did this to yourself. You're the one who's, it doesn't do anybody any good to continue the shame and the frustration. What we can is sort of, bring those to light and allow the individual to use us as a sounding board to talk about them, to see like, are there opportunities where I could potentially change these consequences from ever happening again?
Yeah. I mean, what I hear you saying is that you or your team of recovery coaches in the emergency department really listen and really get a feel for where the person is, and that you try to join them there. And correct me if I'm wrong, Maureen, because you've been in the medical field for a while, but I'm thinking that in the past you could have the same exact situation with a person with an overdose or an injury resulting from an accident that was caused by substance use. And there would be more of like a surface engagement where the medical condition, the tissue condition would be treated, and then there'd be a discharge and an appointment. But there really wouldn't be that engagement of the person. Is that correct?
Yes.
Not to knock.
No. The historical way we did things was you would come in some sort of addiction crisis, and maybe you have a broken leg or you have respiratory problems, and our focus was fixing the broken leg or fixing it up, taking care of your breathing problems, making sure that your systems are working. And referring you to an appropriate treatment program.
Right.
And then you leave, and I have to imagine you feel either unsupported or you call and you get a message, and there's your attempt, and then you sort of give up. And so the work that Cam's team does really, to me, feels like holding the person's hand as they try to navigate a system that is, our healthcare system is difficult to navigate for somebody who isn't living with a brain disease. And so when you layer addiction on top of that, it's even harder to navigate. And I've been a patient of our system myself, and there are times where I make 7 phone calls to get something done, and I know, and I work in it. And so I really feel like it's, even though they're not physically side by side with the person, I really feel like Cam's team is holding their hand as they navigate this.
Right, holding their emotional hand. And how deeply based in addiction and recovery science that is, that this is what people need. They're used to being shunned, they're used to being shamed, they have internalized stigma, they want to get out of the focus.
Right.
And as a result of getting out of the focus, they don't receive the help they need. I want to go to part of the protocol here. It's a little bit technical, but I just think it's incredible. This protocol goes to the suggested activity of the recovery coach in engaging and maintaining contact with the patient. I'll just read one part. So if a patient does not show for the agreed upon second interaction and did not call to reschedule, then the recovery coach will call every day for the next 10 days or until the patient responds. The recovery coach will leave a message every time. This is incredible to me, that the person chooses to not respond and the recovery coach calls every day for 10 days and leaves a message. How much clearer can the message, "we care about you," possibly be? Did you write that?
Well, that was a part of the grant as proposed by the Vermont Department of Health Division of Alcohol and Drug Abuse Programs. The 10-day minimum requirement was something that we sort of contemplated about, is it taking away the onus of the patient or the individual wanting to change? Like, are we taking away that opportunity? But But in fact, what we're doing is we're nurturing that. We're giving them more opportunities to do that. So no, I can't take full credit for that myself. But even then, you know, a lot of the credit of this program, I don't want to miss out on it, comes from the partnership of the state of Vermont, the Turning Point Center of Chittenden County, our executive director, and of course, the hospital. So.
Well, it's really put together really well, and like I have mentioned, no stone has been left unturned, and I'm sure that the patients, you know, there's a qualitative dimension to it all. There's the words and the protocol and the forms, but there's also the unmistakable quality that gets communicated, that resonates with the patient. And I do think that's where the engagement begins. It's that little kind of resonation. Wait a minute, you know, maybe these people do care about me. Maybe this is a safe place. Maybe I can pursue this.
I'm hopeful that it is helping the client or patient feel that they are cared for, and also feel that we understand that that there are going to be missteps. So not going to the appointment doesn't mean you get punished.
Right.
It means we change gears and we try to meet you again where you are,
Right.
and we try again. And if you miss another appointment, we try again. And so the fact that you're not following all of the steps along the way doesn't make you a bad person. It means we have to try a different way to reach you. And so it is a partnership. It is, there's onus on the individual and on us as providers, but we really want to make sure people feel that as a health system, we care about them, and we're going to continue to try to meet them where they are, and they're worth it. They are absolutely worth it.
They are worth it. You know, and that reflects, I mean, T.J. Donovan yesterday at the Recovery Day in Montpelier, the governor proclaimed February 6th, 2019 as Recovery Day in Vermont. T.J. Donovan spoke, and a lot of his talk was exactly that. You're worth it. You're worth, you know, dignity and respect and engagement and resources and perseverance, and every one of you is worth it. It was a beautiful, beautiful message. The message in Vermont is stronger every day. So, Maureen, what about the physicians' response to this program? What have the physicians' response been?
Well, you know, fortunately, as with many initiatives that we implement, we started off with two physicians that we considered champions. So Dr. Wolfson and Dr. Barkoff, both of them, this is a niche that they find themselves in, and they're very passionate about different ways to help people in addiction. And so they were the ones that helped us roll it out to the rest of the physician and provider group. Whenever we're rolling out a resource to a group of providers, it's always helpful to have one of their peers help us sell it to them. It's a new resource, and so as with any new resource, whether we have a new MRI machine or a new drug we're using or a new human resource, it takes time to get people used to the fact that it's there, it is a resource, and then get into the pattern of using it. And so over the course of the last 7 months that the program's been in place, we've seen a very steady increase of number of times that CAM's team is being deployed, as well as the number of providers that are engaging them. And so, it started off a very focused group of people, were comfortable with it, and then that has very steadily grown and expanded to, as people see the success of it, they use it more.
Yeah, beautiful.
Yeah.
I think one of the statistics that I saw was out of 193 contacts, was it 115 people? Do you want to elaborate on that a little bit,
Sure.
those numbers? Because those numbers are important.
Yeah, so after 6 months, we audited some of our data, and we looked at the total number of individuals that we serviced, which was 193. And of that 193, we had 115 choose to have recovery coaching, follow up with them. So choose to have that service of the 10-day follow-up call. provide outreach support, check in, introduce around at the Turning Point Center of Chittenden County, like develop that warm handoff, which is over 60%.
Wow.
Yeah.
That is remarkable. and those people then would engage in recovery coaching, begin to hopefully uncover their pathway to recovery, and they may in fact engage in other services like psychotherapy outside the Turning Point, or residential treatment, or intensive outpatient, or what have you. Is that true? You serve as kind of a conduit if they need other services?
Absolutely, and conduit's a great word. We help facilitate that transition from the emergency department discharge to that next level of care if a patient wishes to pursue that. So we're looking at residential, we're looking at outpatient engagement in medication-assisted treatment, and even other recovery supports that aren't strictly Turning Point Center related. So,
I'm glad that you mentioned medication-assisted treatment, or pharmacological treatment of opioid use disorder in particular. It's my understanding that at this point at the emergency department contact that there are times when buprenorphine will be prescribed. Could you speak, because that's really innovative.
Sure. Yeah, there are two programs going on in the community where this is possible. One is at Safe Recovery, the Needle Exchange, and one's at the emergency department. And so when somebody comes into the emergency department, specifically in an opioid addiction crisis, there is an opportunity to actually not only be prescribed, but receive the buprenorphine right from the emergency department. It is generally a 3-day dose, and we use 3 days to allow us, so it's not just a matter of getting them the medication, but it's a matter of the conduit, getting them into a treatment program. And so the 3-day dose allows us an opportunity to get them from a Friday evening to Monday in the clinic. And so so they receive the 3-day dose of buprenorphine, and then they will see our addiction treatment program on Monday, or if it's a Monday, on the next day, and start the path to a more long-standing treatment regimen.
So this is truly life-saving. So for a person with opioid addiction or a heroin use disorder in the emergency room, that they would be admitted for an emergency in the past and discharged.
Yep.
And if they have severe opioid use disorder, they'll be going into withdrawal, within a few hours.
Yes.
And if they don't have medication, they'll be purchasing heroin or another opioid. And today in Vermont, heroin is almost guaranteed it's adulterated with fentanyl and extremely lethal. So the person discharged from the emergency room with heroin use disorder is at high risk.
Very high risk.
So by prescribing buprenorphine, that 3 days of medication will help that patient to avoid withdrawal and have the wherewithal to engage in continued services.
Yes.
This is truly a life-saving innovation.
It's a life-saving innovation, and it's a recognition, I believe, of the need to provide that continuity. So if somebody comes in and we use Narcan on them, which makes them sort of even more vulnerable to another overdose, we're only taking care of one part of the problem. We really need to be able to get them safely into a treatment program. And our treatment programs are not open at midnight, and so we need something to hold them over.
It's really innovative, and as I've mentioned, truly based in the brain science of addiction and recovery. And you mentioned something earlier when you were comparing this project to yesterday's emergency room, and it just sheds light on that the gravity and the velocity of this tragedy that we face today is causing all of us to expand our minds and educate ourselves. So it's really, it's medicine, it's law enforcement, it's health, it's education, it's community groups. It seems like the whole culture, it needs to respond to this in a way that going forward will be looking differently at addiction. And this, in my view, has been a long time coming. And it's good that it's here, and it's good that we're a part of this, and that our leadership is so open to this. It's really so encouraging.
It's become blatantly clear that the hospital can't fix this, law enforcement can't fix this, the Howard Center can't fix this, and none of us can fix it alone. And it is absolutely dependent on the relationships we have with each other, and everybody looking at the problem from what they can do to contribute to the solution that is going to move this in the right direction. And everybody has to leave their egos at the door, and we work together. And and we've got help. We've got endorsement and help from the state's attorney's office, the hospital, the police, law enforcement, politicians. It's really become an effort looking at. I represent this organization, and what can I do to help fix this? We all have a responsibility.
Well said. Well said. All hands on deck.
All hands on deck.
In closing, I'd like to, I've developed the habit of asking my guests to close with whatever message you would like to give the general public. Understanding that the general public, when it comes to this show, will be treatment providers, healthcare professionals, regular just citizens of Vermont, and hopefully more and more, my hope is that people using substances will be tuning into the show to see what's going on. So I'd like to give you both the opportunity to close the show with your own comments. And I'd like to add to the general public, there'll be an informational slide at the end of the show that'll give you information on how to get in touch with Cam or Maureen or people at the emergency department program. So with that, I'll give you the...
Sure. What I would like to convey is that representing healthcare in this context, that we want people to feel comfortable seeking treatment in our clinics, in our emergency rooms, in any of our services. We want them to know that we've done a lot of work to come up with ways to meet them where they are, and that I hate to say it this way, but we're open for your business. We want to take care of you with your substance use disorders, and we have a lot of different initiatives underway that will help care for that. And so, please come see us.
Yeah, thank you. Thank you.
Yeah. I first entered treatment officially when I was detoxing from heroin, and I entered an emergency department. It was in Baltimore around 2012, and there wasn't any of these programs available. And I was sitting there, and I had my mother by my side, and of course I was just wrapped up in everything that was going on with me, but I couldn't really understand the pain and frustration that my mother was going through.
Yeah.
This disease doesn't just affect the individual, it affects everybody affiliated. The people who love the individual, the community as well. The solution has to be human-centered. It has to be person-centered. So it has to be a collaboration amongst the professional community. Like you said earlier, all hands on deck. And a life is worth it. Regardless of what that life is, a life is worth it.
Absolutely. Well said, Cam, thank you. I want to thank the viewing audience for joining in today. And I just want to say that this is really the beginning. This is the beginning of something new in Vermont. We have a wonderful state here. We should all feel very proud to be Vermonters. The show today, more and more of these shows, they give the general public an idea about the mechanisms and the protocols and the policies and the words, the procedures, which is really important for people to understand that. But What also gets conveyed is the hearts of the people that are out there making these programs come to life. And so thank you for joining us. We'll see you next time.